For this afternoon and tonight, a significant winter storm, including heavy snow with blowing and freezing snow.
Hello, and welcome to the SnowBrains Podcast, where it's my job to interview the most intelligent people in the snow sports industry and pass their fascinating knowledge on to you, our listeners. I'm your host, Miles Clark. I'm a professional free skier, a mountain guide, an Alaska heli ski guide, a UC Berkeley molecular cell biology graduate, the founder and CEO of SnowBrains, and I broke my face blowing a front flip off Alta's Bad News Cliffs back in 2011. My right orbital bone broke in 3 places, including right through a hole in our orbital where a nerve passes through. Ever since that day, my nerve rewired wrong. And now when I touch my upper right lip, I can feel it directly under my right eye. If I drink a cold drink and it hits my upper right lip, I feel cold under my right eye. Super weird and kind of neat. Today's episode of the SnowBrains Podcast is brought to you by Club Med. Escape to one of Club Med's more than 20 mountain resorts in Europe, Japan, Canada, or China, where you find world-class skiing and snowboard terrain, exceptional service, and endless adventure. With their all-inclusive packages, you'll get everything you need for an unforgettable ski vacation, all taken care of. Lift tickets, ski and snowboard lessons for all ages and ski levels, gourmet meals, lively après-ski activities. Visit www.clubmed.us, call 1-800-CLUB-MED, or call your travel advisor today. My guest today is Dr. Kevin Stone. Dr. Stone is a physician, orthopedic surgeon, clinician, researcher, inventor, and founder of the Stone Clinic and the Stone Research Foundation in San Francisco, California. Dr. Stone's clinical work has focused on repairing and replacing meniscus, articular cartilage, and ligaments to keep people active. His clinic treats people from around the world who come for biologic joint and tissue repair and robotic artificial knee replacement. Dr. Stone's public nonprofit foundation, the Stone Research Foundation, focuses on basic science and outcome studies that are mainly concentrated on cures for arthritis and techniques to speed the return for athletes to sports. Hello, Dr. Stone. Welcome back to the show. Thank you very much for being here. How are you?
Pleasure. Great.
Good.
Summertime in San Francisco.
Well, which means it's foggy every day. I used to live there.
How's out there today?
What neighborhood might you be in?
We're right in the marina, and
Okay,
I have the luxury of commuting to work by motorboat.
Oh, no way. Oh, that's so fun.
Once or twice a week, I can come across the bay by my Boston Whaler and park right across the street from my office.
I had no idea. What part of the bay are you coming from?
So I come over from Sausalito.
That's my favorite town. That's so cool. Nice. Well, I always ask some ski questions just for the warm up. When do you think you're going to ski next?
So we've booked a week up in Tahoe for the holidays, Christmas holidays.
Beautiful.
We'll probably sneak over if there's good snow in November around Thanksgiving. And we always try to sneak an Alta trip in there if there's early snow. And we've got a good trip planned this year to Val d'Isere, which I've never seen that for some reason over all the years. And we'll connect on the way over with our buddy Glenn Blake.
No way.
Chamonix on the way. So it should be a good trips coming up for the year.
He is a legend, man. And I actually got to ski with him a couple times randomly, once in Kirkwood and then once in Verbier. And he's just his laugh and his diamond tooth, the whole thing is just amazing. Well, cool. Well, let's jump into it. Today, I really wanted to get into what you think is best for exercise, for food, what you recommend for skiers and snowboarders in the summer off season, or I suppose anytime they're not skiing and riding. And the idea being to prevent injury and be as strong as possible going into the season. So I thought we could kind of start with introducing yourself a little bit. So could you tell us a little bit about your background and how you became involved in the world of skiing and orthopedic surgery?
Sure. So as a kid growing up in Providence, Rhode Island, which means that you drove 3.5 hours up somewhere to ski, although there was a little ski hill, Diamond Hill in near Providence that we would get out on every once in a while. Our school had a little ski race team on that hill.
Oh, that's cool.
Wasn't much though. And so as a kid, you grew up skiing ice, as all New Englanders well know, and didn't really hear about the West until my brother bought a condominium at Alta.
Ooh.
By then, I was already a college student, and my brother was a Harvard Business School student. And he invited me out there. And while we were there was this guy walking around with a poster board on his chest saying, come to dinner and hear the story of our timeshare. And I'd heard about timeshares and the timeshare hustle, but I figured I was with my big brother from the business school, and no chance could we get in trouble here. Of course, by the end of the dinner, he'd bought a timeshare and he'd had me buy the room next door. And the cool thing was it came with 100 lift tickets to Alta.
That's incredible.
So back then, of course, the lift ticket was only $7, but that got us involved in skiing Alta all those years, and became, of course, addicted. And when I finally became an orthopedic surgeon, I had a chance to be a doc for the U.S. ski team. So for a dozen years, I traveled with a women's alpine team and got exposure to another kind of skiing and another aspect of the ski world. Was addicted ever since. And as an orthopedic surgeon, of course, I'm here in San Francisco, practice at the Stone Clinic. We have a public nonprofit research foundation. And over the years, especially early in my career, we had an awful lot of skiers living in our house as they came to San Francisco for knee care and shoulder care and ankle care, which is what we do. And they'd stay with us and rehab. And I had a good fun way back then of also appreciating that skiers then did not have great access to nutrition information or rehab information. The U.S. ski team camps were mostly on snow camps, and there really wasn't a great off-season program at all. So in the 90s and in 2000s, I ran a number of training camps here in San Francisco for not just U.S. skiers, because I was also covering the Pro Tour, and I covered Jeep King of the Mountain and Johnny Mosley's events and Darren Rolfe's events. And so over the years, we would put on off-season training camps for these guys. And it was a lot of fun teaching back then about nutrition and rehab and sports injury prevention, and just had the love of skiing and skiers and a soft spot in our heart for how to keep people on the snow, and with a goal of having them drop dead at age 100 on a ski slope somewhere.
I love that. And I think it is something that I don't think about enough. I think a lot of us don't, is that, there's so many important pieces of skiing. You got to have the ski patrollers and the lifties, and you got to have the actual skiers, and you got to have the mountain. There's all these pieces that we forget about the medical doctors. So for me, I always, thanks to you and what you do and all the medical doctors who work on us, because I think it's just so common for skiers and riders to get injured. And without you folks, we're just not going to get back out there. And that you're digging into the other side of it too, figuring out how we can rehab ourselves and be strong is so important. So I'm excited to talk about all that today. And in my mind, you focused on biological joint replacement and sports medicine. And I'm curious, what sort of inspired that? Because I'm sure you're as a doctor, you could have gone a lot of directions.
I was out for a run with my mentor at the time, a guy named Dick Stedman, who many of you in the ski world will remember. Mm-hmm. And he looked at my bow legs and my knee that had had its meniscus cartilage removed as a soccer player in college. Ooh. And he looked at me and said, Kevin, if you could ever figure out how to replace the meniscus, you'd make a real contribution to orthopedics. Mm-hmm. So that was the beginning of my research career. I started out in that project in 1984.
Wow.
And by 1986, I had designed what was called the first collagen scaffold for regrowing the meniscus cartilage. And then we tested that in a number of animal models, and then humans here at my clinic in San Francisco, and then wide clinical trial around the world and in the US. And eventually the collagen meniscus implant became the first tissue regeneration product available for people to regrow tissues inside their knee. And so that launched my career early on. And then we expanded to other aspects of tissue regeneration, meniscus cartilage replacement, which I do an awful lot of now for skiers, both old and young, and regeneration of articular cartilage, the bearing surface of all joints. And then, of course, over the last 10 years, it's been a huge push on growth factors and stem cells and other ways of stimulating regeneration that we're enormous fans of, and pushing forward the science around how do we make that better and better.
Well, we appreciate that, because especially with my knees and most skiers and snowboarders' knees, as we age, we're going to need more and more solutions to continue living this life that we love. And just to kind of right off the bat, I am curious, in your mind at least, I know this is always subjective, what do you think are the most common injuries that skiers and snowboarders face? And why do skiers and snowboarders get hurt so often?
Because we're all crazy.
It's kind of a crazy thing to do.
Because if we really knew the real injury rate, nobody would do it or be allowed to do it or something.
Oh
Uh,
gosh, I think it's
it's
true.
just, we love it. And that's why, and it's an addiction and it's fun and it's unlike anything else. If you ski with your kids, it's about the only thing you do, sport you do with them all day long.
Hmm.
Morning till afternoon, you're
Hmm.
together in the sport. And there's so few other sports that are like that. And just the giggle it puts on your face when you look at your kids start to ski and play with them on the mountain and spend time with them at all ages, develop that addiction early on. And so I'm biased because I treat shoulders, knees, and ankles. And so I'm seeing shoulder, knee, and ankle injuries much more than I'm seeing, let's just say, hand injuries, which obviously occur very frequently for skiers, but I don't see it here in our clinic.
Hmm.
And so we see a bias of different types of injuries. Our snowboarders, we see contact injuries from, which is, why helmets became so popular early on and became
Hmm.
so widely adopted. It was really the collision injuries from snowboarding, as well as the impact injuries from ski racing, of course, that pushed us over to have recreational skiers wearing helmets so often when really head injuries were not a big part of free skiing.
Right.
So in the injuries that I see, it's more around tears of the meniscus, tears of the ACLs, dislocations of the shoulder, tears of the rotator cuff, injuries to the ankle is one group of the young, healthy skiers. And then in my older skiers, all my arthritic skiers who've been around other sports and other activities for many years, the question is, how do we keep them on the snow in a healthy way? And how do we
Hmm.
keep them enjoying their sports? And so I have a dichotomy. As I'm getting older, my patients are getting older, and I see a wide range of both young and old treating these injuries. And the good thing is that most of them now are so treatable. The rehab programs are so much better. The ski equipment's so much better, but the
Hmm.
injury rate's happening pretty much at the same rate, although a little bit different types.
And the rate is tough to qualify truly, but I've heard, in professional industry, somewhere on the line around the number of 1 in 1,000 skier visits gets injured. And I don't know if that still holds true. And a skier visit is just one person one day. Every 1,000 people or every 1,000 skier days, one person gets hurt. So I don't know if you've heard different or you
Yeah,
understand different.
we think the data is awful.
Yeah, that's kind of my
And
curiosity
the
on it.
reason is that nobody reports a lot of the injuries that they have
Hmm.
unless they actually get dragged into the clinic at the base of the mountain and it actually gets reported in through one of the systems.
Right.
Most of the time, people get hurt, go home, nurse their wounds, and maybe call the doc or maybe not. And it
Right.
never really gets reported. And so we think we really don't have a good handle on what injury rates are. And in part, a lot of us really want to close our eyes
Right. Yeah.
because we're so addicted to the sport and we don't really want to think about it too much. We want to take all the things and do all the things we can to ski in a healthy way, but we still want to ski.
Absolutely. Yeah. And are there reasons I think, I mean, it seems really obvious. You're going downhill fast, and if anything happens, it's going to happen quick. You could hit something, twist something. But in your mind, are there reasons skiers and snowboarders get hurt?
Sure. Most common reason is a mental error. And I think you and I have talked about that a little bit before too, or,
Hmm.
your mind just wasn't in the game. That momentary bit of distraction of thinking about something else, your cell phone rings or your work issues or your girlfriend or boyfriend or something. There's just a momentary lapse of judgment. And the reason we know this is because so many people say, I knew I shouldn't have done that,
Yeah.
whatever, reached out at that moment, taken that
Hmm.
particular decision. So it's a decision tree, whether it's a choice of a run or a condition or to continue at the end of the day or a momentary decision of how to edge the ski or where to put your weight. Almost everybody seems to know, I wish I hadn't done that, or I knew that I shouldn't do that. And
Hmm.
so that's easy in a sense to work on. All the good tools of putting your mind in the game, of focusing when you're there, of getting rid of the distractions, of enjoying the sport by being in the sport and not being somewhere else when you're on the pitch. And so there's so many things you can do to help avoid the avoidable injuries. And there are all the others that aren't avoidable, but the avoidable ones make up an enormous amount of it. The next part of it that's kind of unusual for many people to realize is that as the skis have gotten better and better, easier to turn, as the equipment's gotten more comfortable, as the lifts have gotten more efficient, six packs flying up the mountain, what that means is that everybody has higher risk exposure, meaning they're on the snow more. They're enjoying it more. Skiing is easier to get into. It's other than the cost. It's
Right.
easier to spend time on the snow. We can talk about that. It's easier to spend more time in the snow. It's easier to get exhausted faster. And so your injury exposure time is higher. And yet the technology for protecting your knees and the rest of your body has not improved. The ski bindings of today are marginally, if at all, better than the ski bindings of 10 years ago. What other sport can we think about when the critical factor that binds you to the ski or to the sporting instrument or whatever, where the failure rate of that device is so important, have there not been any significant improvements in? And if anything, there have been some negatives. As we get higher off the ski, as we go onto wider skis, we know the torque on the knee increases and the rate of ligament injuries increases. And so even though we've gotten on more turnable skis and more fun skis, depending on the conditions, we haven't improved our equipment.
Well, I think that's especially the first point. I think the second point of it, the skis themselves, obviously I've read a lot about how the wider skis put a lot more torque on your knee, but I really like that first point of it's mental, because I think we talked about also, I dislocated my shoulder last year. And as soon as I did it, I was like, what the hell? I wasn't thinking. I don't know why I did that. I knew not to do that. Did it anyway. So these are some of the reasons that we end up getting hurt. And so I'd love to talk about some preventative things, the importance of summer training. In your mind, and I know that you're very involved in this, why is summer training or off-season training so crucial for skiers and snowboarders? And what might be the main benefits?
So let me surprise you by saying even an unexpected response to that answer, given that I've run so many skier training camps over the years and we run a ski prevention injury camp here in the clinic in San Francisco. And we have a long history of trying to teach skiers to think about it in the off season. So I just absolutely am starting to drop that verbiage.
Oh, all right.
And here's why. I don't think there's any off season. I think all of us who love to ski really love other sports too. And we love playing year round. And the concept now of sport specific exercises, I think, is really going out the door.
Oh, wow.
And so we now use verbiage with our own patients and our athletes who are coming through is, listen, forget about training to ski. Weird for you to hear me say.
Yeah, it's bizarre.
Think about training for every day in every sport that you love. And realize that you'll be a better skier if you're a better runner, if you're a better paddleboarder, if you're a better windsurfer, if you're a better cyclist. Pick your sports that you're doing now and think about how do you optimize your body for those sports. And if you do that, you'll have a lot more fun. And your stickiness to all the things we've been preaching for all these years, stickiness meaning your ability to keep doing it every day, will definitely go up. If I'm not saying, yeah, you have to do this so that you can have fun 6 months from now or 3 months from now or whatever. Skiers simply don't do well with, hey, I'm going to do this for a better reward later. We failed at it. I'm raising my hand and saying we failed at that. And so what we really want to start thinking about in our verbiage to our athletes, injured or not injured, is put the joy in every day and think about how to optimize your fitness today in so many different ways. And then you'll be a better skier. And when you're skiing, there's a whole host of things we can do during ski season because we're thinking about skiing a lot. But when you're thinking about everything else right now, let's have you think about everything else and look at your body and look at your cardiovascular system, look at everything you want to do and think about how we can optimize that.
Excellent. And then I know that you guys have some, maybe ski specific, now I feel like my whole line of questioning is upended. So take me, for example, someone who skis quite a bit. What exercise would you recommend? Does the Stone Clinic recommend that could specifically help skiers or just athletes in general?
So I'm going to answer that question the same way.
All right.
What do you love to do?
Today, I feel like I'm exhausted, kind of resting, but I do want to get a leg workout in because I leave for South America in a few days. So I know that I want to kind of keep my legs fresh.
So let's forget about the leg workout.
Okay.
Because it's as if you're dissociating your legs from the rest of your body and your heart and your mind and everything else.
Uh-huh.
So I want you to think about your whole body, including your mind, but your whole body.
Mm-hmm.
Think about, what do you want to do to play today that's going to build your fitness, thinking a lot about your lower extremity fitness and core and balance and proprioception and ability to feel strong and powerful when you stand up from that chair that you're spending too much time in. And
Mm-hmm.
so what brings you joy today athletically, and how do we optimize that sport, that activity, to build upon your base for other sports too? And so the first question is, what can you do today to have fun? And we don't want you to work out. We want you to play out. We want you to get out there and go play, because play is fun and play is joyous. And play, if you do it well and with purpose and intention, can really be a great fitness program.
Yeah. And I guess for me, that would be, I could go hiking. I have hills in the back of my house.
Exactly. Right out the door and go put a smile on your face. And
I like that.
And I think that's a lot better way to talk to ourselves in our own voice inside our heads, and to talk to our patients and friends who are injured and trying to avoid injury as well. So the other part to that to really be thinking about is, as we talked about earlier on, if mental errors are going to be the source of your injury pattern so commonly, what can you do when you're going out to play today, or when you wake up first thing in the morning, that can help train your whole mental approach? And so many people use meditation. I don't like taking time out of my day to sit quietly and think. I don't mind thinking a lot when I'm on a rowing machine, or when I'm on a Peloton, or when I'm doing something that's really pretty repetitive that I'm doing for a host of reasons, partly joy, partly fitness, partly cardiovascular, but I can let my mind run. And if I can let my mind run, and then at other times think about how to discipline my mind to think about something specific, meaning to be able to focus. And if I can focus for 5 minutes, 2 minutes, 10 minutes, then I'm training my ability to put my mind in the game and avoid an injury when the chips are down, when I'm on something steep and scary and ornery and I knew I shouldn't be there, or I'm whatever. I can get my mind focused and avoid those injuries, that snow snake that's going to reach out and grab me because I'm making a dumb move. So I'm using my sports playtime to use not just for my physical fitness program, but for my mental fitness program too. And I think as people start to get more sophisticated, more mature in their training and their ability to use their playtime, they can combine a host of benefits together. You know, we always used to talk about squats, and we used to talk about side-to-side exercises and dynamic exercises. And all of those, of course, are awesome. You know, the most efficient exercise any skier can do for skiing around, thinking about skiing fitness, is a squat, a dynamic squat. But again, adding in a play component to that with a weighted ball that you're throwing to a friend or training buddy back and forth makes a weighted squat a lot more fun, a lot more dynamic, a lot more interesting, and a lot more playful than just putting a rack on your back and squatting, or a kettlebell in your hand. So with every recommendation, if I want it to be a meaningful one that you'll actually do, my job is to figure out, how do I connect to things you really enjoy doing?
Well, that's terrific. And so if I'm hearing you right, it's difficult, you've understood now. And like you said, you raised your hand and said, we have not figured this out, how to get people to train in the off season. That a better focus is to find things that you like to do that involve good exercise that you can go out and do, maybe outside, maybe even inside. But if you have access to go out and do something, ride a bike, go for a hike, play basketball, do something that you think is fun, people are going to stick with it more, is what you guys have found, and have better results in the end.
Yep.
And I like the focus thing. I've been meditating for only about a year now, and I have really found that it's dropped my anxiety. I've gained patience. I think I have a little bit less just kind of day-to-day fear. And when you say that you're out there, so for example, I'm going to go for a hike today, and that is a place where I do most of my meditation. At least that's how I speak about it. But I know it's not the same as a traditional sit down, close your eyes meditation. So when you say focus, because I often just kind of let my mind untangle and try to get to a place where I'm not really thinking about anything but the moment, what kind of focus do you refer to when people are out there, for example, on a hike?
So the untangle comment that you made is traditional meditation thinking. It's, how to declutter your mind. And it's really an important skill to have. I've just never really had it, but I realize that many of my patients do have it and my friends have it in great lengths. And I admire people who can do it. But so what I find is how efficient can I be and how effective can I be at centering my mind on a thought or on an activity or on a problem, not letting other things come in and distracting me from thinking that problem all the way through, either to a creative solution, a new invention, a new way to do something, or just an interpersonal solution about an issue that I need to solve. And you'd be surprised how many people, and how even within our own self, a lot of the day, we just can't do that. We start to think about it, and within seconds, our minds wandered off somewhere else, or 5 other things have popped in. And why is this important? It's important because, as we talked about in the beginning, sports injuries are so often mental errors. And if your mind can only stay focused for a little bit and then distracted again, a ski run is several minutes or longer. And we want you to be able to be in that moment that whole time, enjoying it, loving it, but conscious about the decisions you're making and staying free from an injury. Otherwise, you're in my office.
It's great to visit with you, but you don't want to be in Dr. Stone's office. It means something's gone wrong, and probably one of your major joints that you need to go skiing and riding. I like that a lot. I went surfing just a handful of days ago, and it was a pretty critical, challenging wave. And right before we went out, I had 3 friends, and one of my friends is a big hippie. And he's like, all right, let's really focus today, right now, before we even paddle out, about everything we do. And he kind of asked us, what's your biggest challenge? And mine is the drop in. As I pop up, I often make a mistake and crash. And he's like, all right, today when you pop up, I want you to really go through, just stay locked in all the way through. And I made every single pop up except for one. And the one I didn't make was because I didn't believe I could make it. I was really, really late. And I had a little bit of air, the air drop, they call it in surfing. And I didn't believe I could make it. And then I almost kind of made it, even without believing it. But all my other ones, and I had some other ones that were quite critical, I made them all. And that never happens. And it was because the whole session, I was to the fingernails, every motion really focused. And I think maybe that's something you're referring to here.
I think you said it beautifully.
Well, thank you. Well, now a lot of my questions are about what to do. And so maybe we'll talk about, I have a question here, what not to do. So what might be some common mistakes skiers and snowboarders make when they're training and not actually on snow?
Yeah, so the training errors that we see often are the repetitive, let's say, strengthening, use the word to focus on that, or repetitive motion without combination exercises. And so people are just doing biceps curls, or people who are just doing, a leg extension machine or something that's really not very sport related. Because there's almost no sport where you do a leg extension. Even a kicker kicks from their hip. Right. And leg extensions tend to overload the patellofemoral joint. So we don't love seeing our patients come in with anterior knee pain after using a leg extension machine, or a wall sit where they sit there against a wall thinking it's going to help their quads. Well, there's just no sport you're doing at all where you're sitting there statically like that, overloading your kneecap. Do a dynamic wall slide rather than a wall sit. And so I think the errors we see the most are focused too much on one activity, not enough dynamism in most of the workout, and then overloading when they're not really prepared. And then the mind not being in it, just rolling into the gym, not warmed up, not prepared, jumping on some machine or some weight. So it comes back to that skiing preparation. What do you do before you buckle on your boots, or you strap on your skis, or you jump on the slope? Can you take a few minutes to just pause, stretch if you want to on top of the chairlift, which is my favorite thing to do, and just sort of get you in that mind of where are you, letting go of other stuff, being in the moment and enjoying it. And so those are the common things I think we see more often than anything else.
That makes sense. And that goes along with what you're saying before. Find something fun that involves your whole body. And that's a real sports movement that you can stick with and do every day. This episode of the SnowBrains Podcast is brought to you by Club Med, calling all ski enthusiasts. Elevate your winter getaway with an all-inclusive experience at Club Med. The resorts in France, Switzerland, Italy, and Quebec offer a seamless blend of breathtaking ski adventures, locally inspired cuisine like fondue, and lively après-ski delights, all included in your package, so you can focus on conquering the slopes, indulging in the flavors, and creating unforgettable memories with your loved ones. Visit www.clubmed.us. Call 1-800-CLUB-MED or call your travel advisor to craft your ski dreams. And I am just curious because skiing is so, at a ski resort at least, is not a ton of cardio. Backcountry skiing is obviously the exact opposite. How much do you think that running and cardio help skiers just in their overall performance?
Oh, I think huge, because most skiers in America anyhow are coming from an urban environment and going to altitude. So it's the altitude shift and hydration shift and change from exercising an hour a day to exercising 6 hours on a ski slope. So it's the totally dynamic shift of environment and an activity load that they're really not well prepared for. So I think that's what we see the most. We see it immediately, of course, in the beginning of the season, but we see it during the season too, where people get in, a day or two a week or a month and then jump on again without that preparation. So what is preparation? Preparation, as we talked about, is being an athlete year-round, having fun. Preparation on the day of skiing is warming up really well in shower and hot tub, stretching before, just sort of getting your mental preparation in the game, being warm before you're on the slopes rather than jumping in right away. And it makes a huge difference. Preparation also means looking at your equipment. You'd be shocked at how many people put their skis in their bag at the end of the year and don't unzip that bag until 6 months later. Then even then, don't take their skis out and prep them or look at their bindings or anything else. And so ski prep, equipment prep, updating your equipment, this stuff actually really does matter. Ski boots are a wonderful example. I mean, people are still skiing in casts. And yet skis have evolved to be so easy to turn with really mid-ski balance, a much more upright position. And for the recreational skier, they just don't need to be in a rigid boot trying to get their weight forward. They can really stand up on the ski in a much more flexible boot, use their ankles, enjoy their position, not feel so much pain. And yet many skiers haven't made that evolution, which really occurred more than 5 years ago. So looking at your equipment, updating it, not being embarrassed to hire a ski instructor or coach or a really good skier to take you out the first day or two and say, hey, take a look at what I'm doing, all my old habits before I get back into them for the ski season. How about giving me a little tune-up? And it's such a nice thing to do, and so few people do it often enough.
Yeah, I agree. And, I read your book, Play Forever, which is revolutionary. I like so many great tips in there. And I do like how you talk about how, the boots don't have to be like the way they were, especially how good that gear is now. And a lot of good examples. And I am curious about that too. Do you have any fun success stories from athletes that have kind of followed your programs and I know that you're making this shift and how recent was this shift where you guys kind of thought, hey, hand up, I don't know, I don't think this rigid workout routine works anymore. Go have fun.
Yeah, it's a little bit been happening a little bit each year over the last few years until finally we just said, we'll keep doing the programs because we have so many good examples of athletes who thrive on them. There's a athlete who comes to mind who will let me use his name, a ski instructor at Sun Valley named Mark Miller, who's come in and done about 90 days of pre-ski season training with us over the last 3 years, and then 90 days on the slopes each year. So he really uses our program effectively for really side-to-side dynamic ski motion training, which he loves, and then he goes and uses it with athletes at Sun Valley. And so he's just a beautiful example of somebody who totally drinks the Kool-Aid at an older age. I won't reveal his age. And we have so many others like him who say, listen, this really matters to me. Now, on the other hand, I've got a number of very arthritic older patients who come in with x-rays that look absolutely horrible in stiff joints and who should have a joint replacement or a partial joint replacement, which we do lots of these days. And they say, hey, doc, I'm not letting you operate on me until that lube job you give me stops working.
Right.
And so they come in and they get a PRP and HA injection. PRP are the growth factors in your blood, and HA is the lubricant. And we have a way of combining all that together, and we call it a cocktail or a lube job for them. And many patients will use that to help them loosen up their joints, shoulders, knees, and ankles. And it's a way of getting them through a ski season when you otherwise would think, hey, they're too arthritic, too stiff, too much poor motion to be able to ski. And so we have these tools that permit people to cheat. I feel
Yes.
badly as an orthopedic surgeon in one hand. Am I just helping my patients wear out their already kind of worn out joints? But on the other hand, I'm helping them enjoy doing the sports they love to do. So we have this whole combination from young people who forget about talking to them about pre-ski season training. They don't listen and don't stick with it for more than the hour that they're here in our clinic. Talk to them about cross training in sports and playing different sports and enjoying picking up skills they don't have, especially testing them in hip abduction and other things that they tend not to train because they tend to be too much in line with their sports and not looking at dynamic motions. To older people who are some who are very flexible, most who are very rigid with arthritis and who still can ski beautifully and want to ski beautifully and really don't care if they can do a yoga pose or not.
And I'm one of those lube job patients. So, we talked about last time that my solution to the arthritis I have in my post-surgical knee is the PRP injections, and it's been revolutionary. I've been doing them. I'm doing every 6 months, every 4 months now for a few years. And there was a point when my arthritis first started that I thought I was done. I mean, I couldn't bend it past 90 degrees once it got swollen, and it would get swollen so quick. So that's amazing, an amazing technology that's really worked well for me. And
we think so too. We do tell people though they do start to wear off, and so a lot of our research, we have a public
less effective with time, you mean?
Yep.
Okay.
Our public nonprofit research foundation, stoneresearch.org, if you want to see the kinds of research we're doing, is focused on how do we make those injections work better. And there are ways to make them work better, and we're focused on that now. But then at some point, we have to repair what's broken. So either we have to regrow the cartilage in someone's knee, we have to replace their meniscus, or we have to do a partial knee replacement or a full one, all of which permit people to get back to sports. We don't limit their activities anymore. And it's true, the shoulder's a little bit different, where lubrication and repair are pretty effective. The cartilage replacement techniques are not so effective. The ankle, however, cartilage replacement techniques are extremely effective. And we see very worn out ankles that we can graft and save them from having a fusion or a joint replacement. So yes, we want to use the tools in combination with exercise and mobilization, great physical therapy, great tissue massage in order to keep people active. But no, we don't want people to get so discouraged that they give up their sport. We say, hey, at some point, it's better to surgically repair what's broken and keep going.
And what might be some of those ways that you can make the PRP injections more effective?
So let me explain the science a little bit. PRP are the platelets in your body, which are a component of the bloodstream, have these little granules in them that contain growth factors and recruitment factors, anti-inflammatory factors, anti-scarring factors. And so when we take your blood and spin it, we can activate those growth factors when we inject it into a joint, almost always in our case, with associated lubricants as well. So they have a local effect, shutting down inflammation. They have a local effect of stimulating the cells and the lining of your joint to produce more lubrication. They have an anti-scarring effect. But most importantly, they have a chemotactic effect or a paracrine effect. They can recruit cells from around your body, your stem cells, to migrate to that site of injury and affect a more sophisticated part of the healing response.
Wow.
So what we're learning is, can we optimize the recruitment factors and stimulate a bigger cell response? So rather than injecting cells into someone, we no longer aspirate bone marrow or fat or grow up people's cells in culture, because we know you have billions of cells in your body, and our job is to recruit yours. And so a lot of our research is around how do we do that most effectively. And it's a great field, and I think we will have much better injection techniques over the next window of time.
Well, that's great news for skiers and snowboarders and me. So thank you for that. Are there any new advancements in sports medicine and that you're excited about?
Oh, tons. Pick your spot.
Yeah, so, well, I mean, whatever's most on your mind.
So we start out with ACLs, because ACLs have always been the bugaboo for all skiers and athletes. So ACL injuries had a surprisingly high rate of re-injury or ACL reconstruction failure. So probably the biggest advance in that space is that when we do an ACL reconstruction these days, we add what's called an extra-articular reinforcement to it, or extra-articular tenodesis, or there's a number of names for them. ALL, anterior ligament reconstruction, is another name for these things. But what we do is since we're biased here at Stone Clinic to use donor tissue, we add an extra tissue to the side of the knee, which diminishes dramatically the re-rupture rate. So re-rupture rate for ACL reconstruction varies anywhere from 5% to 30%.
Whoa.
And when you add that extra articular reconstruction, you drop the re-rupture rate, the failure rate, to single digits pretty reliably. And so
impressive.
Big change in the whole ACL space has been that addition of that extra tissue. There's a lot of your listeners will ask about ACL repairs, because ACL repair is a hot topic these days, because there's a new device out to help ACLs heal. It's not clear yet whether or not it's a big advance, or whether or not we'll still see a lot of failures from ACL primary repair. Around the ankle, things that we're excited about are the regrowing of cartilage in the ankle joint. Even in severely damaged ankles, we've been taking ankles that have no joint space at all and recreating a joint space for them. And so many people who have given up skiing or had a lot of pain from their ankle, we think there is an opportunity now to restore some motion and diminish pain dramatically in those ankles. The shoulder repair space is a dynamic space as well. Everybody who's had shoulder injuries knows they take much longer to heal than you would ever want them to, even when they're repaired well. And I think the injection part of the world will help to speed up that healing time and certainly diminish the symptoms time. And the grafts around the shoulder are getting better. But almost every shoulder injury still takes much longer than we want to see to have heal.
Well, thank you for that. That's really exciting as skiers and riders, because we get banged up and we need all this stuff to keep moving forward. Especially for me, I'm really hoping that knee replacements and half knee replacements keep moving forward at a good clip. Let's bump over to nutrition, and we'll start with the real basic question of how important is nutrition for an athlete, particularly skiers and snowboarders, both in terms of performance and injury prevention.
So here you're going to hear another surprise answer from me.
I like it.
Nutrition is the worst science in all of the sports medicine sciences that we have.
Oh, tell me why.
Absolutely worst.
Yeah.
And the reason is that everybody has an opinion.
Oh, yeah.
Everybody has a methodology, a diet, a supplement, and none of it, absolutely none of it, has really good science behind it. So yes, we fall back to the basics. Basics meaning have a basically protein-based diet, eat what grows in the ground, eat what your grandmother would recognize, all the usual phraseology that we all have been using over the last 5 years or so around trying to just get rid of processed foods. But at the end of the day, none of the data shows a relationship to definitive outcome. And so
wow,
each person has got to think about how do they optimize their fueling for their body, which is how I like to think about it. What fuel do you need to perform the sport that you want to do? And how do you optimize your weight? Because clearly excess weight makes a huge difference on joint health. And here's why. You take 2 to 3 million steps per year at normal body weight. If you lose 10 pounds, and by the way, it's up to 5 times your body weight. So if you take 2 to 3 million steps per year, add up to 2 to 5 times your body weight. So if you step off a curb, that might be double your body weight landing on one leg, right? If you jump, you might be up to 4 to 5 times your body weight from jumping off something. So if you lose 10 pounds, that's 10 pounds times 2 to 5 times 2 to 3 million steps per year. It's an enormous amount of force difference on your joints. So optimizing your weight, dropping your weight, usually getting your weight where it should be for your frame and for the sport that you want to do, is the most important thing you can do. How do you get there? Varies all over the board. For people who have trouble losing weight and are obese or are pre-diabetic, the new drugs, the GLP drugs, are enormously effective.
Like Ozempic, correct?
Exactly.
Mhm.
And there's no question that they will be a ubiquitous part of healthcare in America because, 40 to 60% of people in America are already overweight. And so optimizing your weight is the first part of nutrition. And how you get there, we've always been simplistic about it. Drinking water as your first beverage, as I reach over for mine and you reach over for yours. And I'm very proud that you have a gigantic water glass.
I do.
It's the simplest thing you can do. Every time you reach for a beverage at any time of day, if you reach for a water first and drain the glass if you can, but simply have enough water, and then have your beverage that you like for satisfaction or a cocktail or whatever it is that you prefer to do. If you can down that glass of water first, number one, you'll be hydrated. Number two, you'll drink less of something else that has a lot of calories in it and might not be as healthy for you. So water is your key go-to. And if we could just instill that in everybody, it would make an enormous difference. Lean protein is still, our recommendation for how to optimize your diet. If you're choosing to get most of your calories from lean protein, you're probably making a good decision. And then all the rest of it falls into bias, beliefs, not great science. Would love to tell you that one thing or another matters, and it's just really unclear that it does.
Well, that's really helpful. That's just to hear that, because I think everybody can relate to essentially what you're saying, that every guru that we see or hear from or see on podcasts, they all have a little bit different information. They all seem to be referencing different studies and have different recommendations. So it is really impossible for people, I think, in this day and age to figure out what the hell to eat. And I think the basics are what you said: drink a lot of water, eat whole foods, right? Eat whole natural foods, and that's going to put you in a good place. And then the lean protein is important for athletes as well. And one thing that stuck out in my mind when you were talking about the amount of steps and the amount of body weight, I think a lot of us do hear and think and feel that being overweight would lead to your joints wearing out faster. And is that something that you guys see clinically?
No.
No. Interesting.
Your joints can go for a lifetime as long as you don't have an injury.
Okay.
So once you have an injury, let's just say you tear the meniscus cartilage in your knee, all of a sudden the force transfer through that knee is now concentrated on a smaller area, and so is abnormal. There, increased weight makes a big difference because force transfer through there leads to a rapid rate of degeneration of the cartilage. If you don't have an injury and you have normal joints and you have good mechanics, you can run forever without wearing out your joints.
Wow.
So don't hold back from sports just because your weight isn't optimal. Use sports as your tool for creating the right amount of hunger at the right amount of time and fueling for you to be able to do that sport.
That is really cool to learn and really helpful. What might be some common nutritional mistakes that you see athletes make?
I don't know if they're mistakes. We're trying to figure out what's the right nutrition for an athlete in an endurance sport.
Okay.
So if you look at our friends who are running 100 milers or running 60 Ks or doing sports that are going on for 8 to 30 hours, what should be their nutrition during it? Traditionally has been goos, sugar-based, loaded for instant energy. And yet when we look at endurance athletes, they're breaking down a lot of muscle and they're set back quite a bit from each either training or competition. And the question is, could we be providing protein or other things during that event that would diminish their muscle breakdown and have them build muscle rather than break it down? And so, that's one area of interesting research right now. How would you make it palatable? How would you make the energy source accessible? Because athletes use sugar because it's such a fast, easily digestible, instantly obtainable energy source. But it's clearly not the best for nutrition for their body.
Right.
And then the next question is, in athletes who are just trying to figure out how do they build muscle, what are the right things to do? We all know creatine is one of the helpful things that's reasonably safe. But other than that, what can people point to? And so as physicians, the first thing we should do is, both for our men and women, is what is their hormone state? Where are they in testosterone level? Where are they in estrogen levels? Can we optimize those? And fortunately, we're far past the resistance for women to use hormone replacement therapy after menopause. We all know that women are much healthier when they do, much happier when they do. And the studies that showed that there was an increased risk of cancer from doing that were really very poorly done and not to be relied upon. So it's same for men. What's the right amount of testosterone replacement or right amount of testosterone level for someone as they age to have? And how can you balance their testosterone replacement against prostate risk, hypertrophy, or cancer, or other things that we think about relative to testosterone? So there's going to be a much better amount of science around how do we optimize the chemical level of the patient and the fueling level in order to build muscle and build bone and not lose it. And I would tell you that this space is, as always, controversial, as always, filled with people with very strong opinions, but should be really explored by every athlete with their doctor and their fitness team to think through who are they, where are they, and how do they drop dead at age 100, as we like to say, playing the sport they love. And in order to get there, what do they need to do to get there? Because just aging alone is not going to get you there without active intervention on your part to build your body and build your mind.
Who do you recommend blood tests for? The kind of test I'm thinking, I go into the doctor, they pull blood, and then I can get my testosterone. I can get all my levels checked. And I think that some people can really optimize nutrition and exercise and more if they have those kind of results, because you can make real decisions based on real data. Who do you recommend gets that done?
Pretty much everybody who wants to improve.
I like that.
Because why would you not want to have the data? People come to me with a knee injury and they say, oh, doc, I have an x-ray, but I really don't want to get an MRI. I said, well, how am I going to make a good decision about your tissues and how to repair your tissue without having current good data? Or they might say, I've got an MRI from a year ago or so. And I look at them and say, okay, that's 2 to 3 million steps ago. I want to look at real data today so I can make a good decision about what tissue's injured and how to repair it. So same thing on health. As virtually all your listeners know, it's almost impossible to find a doctor today, like the old days. Your doctors are tied up in one healthcare system or another, and you go through various levels of what I throw up when they call a provider. Before you can ever get to a doctor who wants to sit down and really think about you and what's best for you and how do we characterize you as a person. It's a troubling stage in healthcare in America, because the right answer to your question is everybody should want to get a snapshot of where they are today and a roadmap for how to get to where they want to go. Yet, number one, there aren't necessarily lots of doctors around who can take the time and really do the kind of thoughtful approach that you'd like to hear. And then number two, a lot of, insurance or whatever might not pay for it. So you have to decide if your ski equipment's important to you, how about your body equipment? And if you're going to spend another $1,000 on a new pair of skis, how about spending whatever it is it takes to get a snapshot of who you are so you can go in there and optimize you as the athlete on top of those skis.
And what markers should we be looking at? Obviously, maybe testosterone, estrogen, the lipid. What factors should we be looking at in our blood? What should we be concerned about?
Yeah, that's a big question, because it really depends on age, previous illnesses, health status, host of things that would be maybe too big for this conversation right now to go through how to optimize that.
So maybe speak to your doctor about your exact situation.
Much sit down and have a really good conversation with your doc with what your previous health issues have been and what your goals are, and set goals with your doc and your training team about where you want to go to, and then read about what's it take for you to get to where you want to go, and come back to your doc with some information too and say, hey, look, this is my fitness data, this is my VO2 max, this is my muscle strength, this is what I can do and what I can't do, here's where I want to get to. Help me lay out a program that's healthy for me to get there, both medically, physiologically, training wise, diet wise, optimize my whole program. And that's a very reasonable request that very few patients actually sort of sit down and say, this is what I want to do. I want you to be my doctor, even though I'm not injured. I'm just not performing at the level I want to perform at. Or if I am injured, hey, I want to use this injury as an excuse to get better, to get, as we say, fitter, faster, and stronger than I've been in years. I'm going to take all this time to heal my shoulder or heal my knee. Well, if I'm going to do that and I'm going to be in rehab for it, I might as well use that time to optimize my fitness program, my diet, my healthcare, and really towards a goal of coming back better than you've been in years. That's the key to doing well.
And I love that. And everything I've learned about that seems like that is the most specific way that you can get better quicker. And I haven't done it yet. So that's one of my next big moves. So my last question here is what supplements do you recommend for skiers and snowboarders?
Yeah, so we've been, again, skeptical on the supplement side of the world. Glucosamine has been the only thing that we've seen a big enough track record that people say they feel less stiff when they take glucosamine. And you can tell if you take it for a few months, almost all women and some men notice that their fingernails are much harder when they take glucosamine. So it's a very objective way of saying, hey, here's a supplement that I'm taking that's actually having a physiologic effect in my body. And almost everybody notices that. And anybody who's given their horse or their dog glucosamine and noticed that they don't limp anymore, the horse or the dog doesn't know much about a placebo effect. So we're pretty confident that there's a supplement that does make a difference. After that, it's really tough to say because none of them have good enough data to say if you use this, you will have that effect. And there's enough science to say this is true for a significant number of people. There just isn't. So I would tell you, when you go out to ski in the day, think about your nutrition for the day, because ski hills are not known for having optimal nutrition options.
No.
And never mind how bad the hamburger might taste. Skiing used to be, as it still is in Europe, we had wonderful Schwendies that you could go into and phenomenal family food that was prepared and that you just loved the whole effect of skiing and then pulling into these wonderful restaurants. Well, in the corporatization of ski hills in America, too many of them have gone down having the exact same food selection, the exact same options, and have killed the local ownership and the local pride that we used to have on ski hills. And so I think you really need to go to the mountain with your plan for how you're going to fuel yourself. And whether that's bringing your own food or that's just knowing in advance what you want to eat during that day, and how to stay nutritionally strong through the day. Because often people will comment on, hey, I shouldn't have taken that last run or those last few runs because I was tired. But very rarely do you hear someone say, I shouldn't have taken those runs because I really didn't have enough food on board. I didn't have enough fuel on board. So think about how you fuel frequently during the day, because you're in the cold, you're outdoors, you're exercising much more than you normally are with environmental conditions that are pulling away your nutrition from the sun to the cold to everything else. So thinking about how do you keep a steady stream of fuel on board permits you to have power on your 3 o'clock run as you had on your 10 o'clock run. And that's really what you want to do.
I love that. I'll stick to my blueberries as my supplement. Well, Dr. Stone, thank you so much for joining us today. I really appreciate you. Do you have any final thoughts or advice for our listeners here at the end of the show?
Advice is that skiing is dynamic and is changing, and healthcare is dynamic and changing, and there are fun things to do. Part of my passion in this whole thing is I love pushing forward the science of what we do, and I love pushing myself forward from a fitness point of view and from a skiing point of view. And I wish I could tell you I was a better skier today than I was in the past, but I can tell you that I'm a more thoughtful skier today than I was in the past. And I think I appreciate my skiing more and enjoy it more now because I bring to it some of the things we've learned from being a physician and caring for patients and being sensitized to how much injuries set us back. And so I would tell you, look at skiing and look at all your sports, find the joy in them and find the thoughtfulness in them as well.
That is profound. And just one last thing, can you tell our listeners where to find more information about you and the Stone Clinic and your great book, Play Forever?
Sure. So the Stone Clinic is here in San Francisco at stoneclinic.com. Our research is at stoneresearch.org. So you can stay in touch with the field that we're trying to push forward and come help support it. It's a public nonprofit research foundation. And I've written several books, but the one that's most commonly out there now, Play Forever. You can find on Amazon. And please do give me feedback. So I'll write another one, and I'm based on the feedback that you give me to try to make it better and better. And I hope it helps you.
Well, it definitely helped me. Dr. Stone, great talking to you. Thank you so much for being here. Have a great day.
Our pleasure.
Thank you so much for listening to the SnowBrains Podcast. If you like this podcast, please share with friends and family, and please make sure to subscribe. To find out more about SnowBrains, please visit us at snowbrains.com. You can also find us on Instagram, Facebook, X, and more. This episode of the SnowBrains Podcast is brought to you by Club Med. Experience the ultimate ski getaway at Club Med, where every detail is meticulously taken care of. With their all-inclusive packages, you can focus on what you love most, skiing. With over 20 plus mountain resorts in the Alps, Japan, and Canada, enjoy world-class slopes, refreshing après-ski activities, and gourmet meals, all while knowing your accommodations, lift tickets, and childcare are all included. Let Club Med take the worry out of your ski vacation so you can simply relax and enjoy the ride. Visit www.clubmed.us. Call 1-800-CLUB-MED or call your travel advisor to plan your stress-free ski escape. This episode of the SnowBrains Podcast was edited by Liam Abbott. Music by Chad Crouch. And I'm your host, creator, and director, Miles Clark.